as an athletic trainer, anatomy is super important because if I have someone like Jamie who sprained her ankle, let's say she's out on the soccer field, she sprains her ankle, it really, really hurts. My knowledge of anatomy, I can run out there and start moving her ankle. And this is what anybody's eyes would see. They see a foot, they see an ankle, okay, yeah, it's moving up and down, that's great. But what I as an athletic trainer see is I see this. I see all of her bones moving, I see all of her joints moving, I see exactly what's going on inside of her foot.
Knowing anatomy is pivotal to what you do. It's really cool to say, what does this muscle do? Where does it go? What does it connect to? What nerve runs to it? So that way, if there's somebody is hurt, you know what's wrong.
We have to use anatomy to figure out illnesses and injuries.
So it's super important to know your anatomy. For example, let's say Sydney was playing soccer and she got injured. When we do assess the knee joint, you need to know the structures, know how they feel and how they move. So in order to assess that, she's going to have her knee here. My hands are going to go back here and sink into her calf, and I am going to give it a force going, what's called an anterior force, going this way. And that helps me determine if it's intact. I could also test her MCL and her LCL by giving a force through here and a force on this outside.
Hello, my name is Ben. I'm an occupational therapist. Something I have here is a little bit of technology that's actually using my eye gaze to type. When I blink, I am able to make this type out whatever I want it to, just by where my eyes are looking.
Hey guys, my name is Kevin Liu. I'm a physical therapist. I work primarily in sports medicine and orthopedics. Dry needling, where we use acupuncture needles that will go into the patient's muscles. That helps increase more blood flow to the area. It also helps release trigger points that patients may have.
So one of the cool pieces of equipment that we carry are called vacuum splints. And as we suck the air out, whatever shape this is in, it'll harden up and almost form a temporary cast.
Occupational therapy looks at getting people back into meaningful things for them. That could include gaming. This is an Xbox controller. As you can see here, this is one of the other joysticks. Someone could be injured and not be able to use their arms as well as they could before, or their fingers. So this is a little easier way to use a little more gross motor movement, where you're not having to use your finger muscles if you're unable. I am able to control just as I were playing with a normal Xbox controller. Now I can play Halo with anyone I wanted to, or do a campaign mode like I'm doing now.
And it's really, really nice if you have a job that you like so well that you would do it even if you weren't getting paid for it. And that's the way I feel about my job. I teach anatomy. I get paid for it. I love it. There's all kinds of different interesting jobs that you can do, and you have the added pleasure of knowing that what you're doing is directly serving mankind.
To be a good student, you have to really want to learn. You have to be willing to sacrifice unimportant things in your life for things that are really important to you.
Keep your mind open. You never know what may ultimately pique your interest.